Diflucan is an oral taken by mouth antifungal medicine. Diflucan is available as a tablet or as an oral solution, liquid. Active ingredient fluconazole. Diflucan is used to treat infections caused by fungus, which can invade any part of the body, including the mouth, throat, esophagitis, lungs, bladder, genital area, and the blood. Diflucan is also used to prevent fungal infection in people who have a weak immune system caused by cancer treatment, bone marrow transplant, or diseases such as AIDS. Diflucan is also used to treat a certain type of meningitis in people with HIV or AIDS. Indications. Diflucan is indicated for the treatment of the following conditions in adults and children: cryptococcal meningitis in mentally alert patients without localized neurological signs, and as a follow-up therapy after amphotericin B therapy; maintenance therapy to prevent relapse of cryptococcal disease in patients with AIDS; systemic candidiasis, oropharyngeal and esophageal candidiasis; prevention of fungal infections in patients with malignancy who are predisposed to such infections as a result of cytotoxic chemotherapy and radiotherapy. How to use. Diflucan capsules are either 50 mg, 150 mg, or 200 mg. You can take fluconazole capsules and liquid with or without food. Swallow the capsules whole with a drink of water. It is best to take your capsules at the same time each day. The usual doses for adults are oral mouthwash, 50 mg a day, taken for 7 to 14 days. Vaginal thrush or balanitis, 150 mg taken as a single dose. Vaginal thrush that keeps coming back, 150 mg taken once every 72 hours for the first 3 doses, then 150 mg once a week for 6 months. Candida infections in the blood or elsewhere in the body, 200 mg to 800 mg a day for several weeks. Cryptococcal meningitis, 200 mg to 800 mg a day for several weeks. To stop cryptococcal meningitis coming back, 200 mg a day taken long term. To prevent fungal infections if you have a weakened immune system and low white blood cell count, 50 mg to 400 mg a day until your white blood cell count improves. For children, your child's doctor will work out the right dose depending on the infection and your child's age and weight. Contraindications. You shouldn't use Diflucan if you are allergic to fluconazole. Many drugs can interact and cause a dangerous effect. Some drugs should not be used together with fluconazole. Your doctor may change your treatment plan if you also use cisapride, fentanyl, methadone, pimazide, tofacitinib, tolvapan, or a vitamin A supplement, an antibiotic, antifungal, or antiviral medicine, a blood thinner, cancer medicine, cholesterol medication, oral diabetes medicine, heart or blood pressure medication, medicine for malaria and tuberculosis, medicine to prevent organ transplant rejection, medicine to treat depression or mental illness, an NSAID, non-steroidal anti-inflammatory drug, seizure medicine or steroid medicine. To make sure Diflucan is safe for you, tell doctor if you have ever had liver or kidney disease, low levels of potassium in your blood, heart problems, or if you are allergic to other antifungal medicine, such as ketoconazole, itraconazole, miconazole, posaconazole, voriconazole, and others. Warnings. Certain other drugs can cause unwanted or dangerous effects when used with Diflucan, especially cisapride, erythromycin, pimazide, quinidine, acetymizole, high doses of tafenidine, and many other medications that are broken down by certain enzymes that are inhibited by fluconazole. Tell each of our healthcare providers about all medicines you use now and any medicine you start or stop using. Before taking Diflucan, tell a doctor if you have liver disease, kidney disease, a heart rhythm disorder, or a history of long COVID syndrome. If you're driving or has this activity, until now how this medicine will affect you, your actions could be impaired. Diflucan side effects. Get emergency medical help if you have signs of an allergic reaction to Diflucan, hives, difficult breathing, swelling of a face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rashes, blistering and peeling. Call a doctor at once if you have fast or pounding heartbeats, fluttering in your chest, shortness of breath, and sudden dizziness like you might pass out, seizure, convulsions, decreased adrenal gland hormones, nausea, vomiting, stomach pain, loss of appetite, feeling tight or lightheaded, muscle or joint pain, skin discoloration, craving salty foods, skin rash or skin lesions, liver problems, loss of appetite, stomach pain, upper right side, tiredness, itching, dark urine, glycolic stools, jaundice, yellowness of skin or eyes. Common Diflucan side effects may include nausea, stomach pain, diarrhea, upper stomach, headache, dizziness, changes in your sense of taste.